very thankful for you being here today.
Appreciate that.
Dr. Tim, and to hear some of the work you do and have done, and we'll get to hear about your work and then have a little time to discuss afterwards. Thank you.
So we don't have a mic, we all okay talking like this? Okay.
Yeah, and we have a crew on Zoom too, so we'll just do our best to bring them in as best as
If something
possible.
washes out, we can't see a slide or something, let me know. Disclosures, first off, I don't know financial conflicts of interest, everything we're going to discuss today, any opinions I give. I do have affiliations, obviously, with the medical school, the National Federation of High Schools, and the WA. Any opinions I give are my own. It may not necessarily affect any of those entities, anything we talk about today. So a little bit, how do we get here? My journey. So a long time ago, long time ago, I was a graduate assistant athletic trainer here in athletics, and I did work with football. I had the pleasure of working with a very tall, skinny quarterback who didn't see the field much and got to know very well, like Paul Christ. He was a freshman that first year, and actually I dealt with him the year before. But interestingly, at the time, most people worked in college athletics. Athletic trainers really focused on college athletics, but there were also an entity started in the late 70s, early 80s, especially here in Wisconsin, to go do outreach, get out in the high schools and communities, and the athletic training presences out there. And I decided I wanted to do that. Even though I was working in Division I athletics, I thought that'd be really cool. So I did that for a number of years. My first job was to start a sports medicine clinic in Montclair. After a couple of years, they asked me to come back down, and I was down here. And my mornings would be spent working in the orthopedic clinic, sports medicine clinic, seeing patients with a physician. So it'd be a physician extender. And working with these physicians every day, ordering MRIs, x-rays, writing PT notes, et cetera, doing those things. In the afternoons, we'd go out to schools, either a bi-weekly school or a school every day, and be there from like, say, 2 o'clock till 6 o'clock, and then stay there for the basketball games. I was getting interested in research and doing some things, and I started going back, taking some classes as a special student, and they had a great program, and I took advantage of that. They were create a PhD. They looked for people that wanted an interest in doing something else, and I said, if you want to get a PhD, we will fund it. You get a PhD, anything you want, we'll make it happen here. So I took advantage of that here at night classes and part-time, and got that done. When I started back at the U, working at UW Health, one of my first tasks was to start outcomes, because we measured quality of life and the impact of injuries and conditions. I thought we need to do this more regularly, and I was a big proponent of that. We need to look at this in terms of how these conditions affect the health of athletes. Since then, I've been able to dabble. I can get involved in part of the Badger Athletic Program. I still do high schools. I get to do some policymaking initiatives, et cetera, through the medical school. I still get to do that. I still do Saturdays occasionally. I work for the Big Ten up in the replay booth for medical concussions, looking for those type of things. So it's a great thing. I get to do a lot. I still work with high school athletes. When I get done here today, a couple hours from now, we're going to head out to Wanakee High School because I do per diem work. And their athletic trainer's not there today, so I'm going to go out and work with high school athletes. So it's great to get to do all these things at once. When we talk about that, what's the scope here? What are we talking about? And I'm really going to focus on adolescence here, not just when youth encompasses young kids and adolescents, but I'm going to talk about really focus on that 13, 14, 15-year-old group in terms of what do we have? And this is a tough slide to look at in terms of, we estimate, probably 60+% of these kids participate in some sort of sport. These adolescents and youth are participating in some type of sport, but that doesn't really get a good picture of this. We do have a better resource if we look at what's available in high schools. So in the high school population, which is good, we have data tracked now for 30 years. We can look at enrollment trends and what's been going on. Roughly estimate 55% of all the kids in a high secondary school setting participate in some sort of interscholastic sport. We have state associations in Wisconsin. We have 400+ high schools. That's actually going up because we have now a lot of small charter schools having sports. So we have this big group. And in terms of participation numbers, as I mentioned, interestingly, I like to look at sports as individual or team. An individual sport is an athlete like track, wrestling, swimming. They compete for their school, but they're really competing as an individual. The team sports are the football, volleyball, baseball. They have to compete as a group. The two most popular sports are track and football. Track is individual. Football is still the most popular team sport, all the way down here, going down to ice hockey and field hockey. And let's remember this, because I'll bring this up later, how we have relatively low numbers in field hockey and ice hockey. But this is a rough generation of what we're looking at 2018-19. Why don't we have 2021 data or 1920 data? Because of the pandemic. We're getting that data now in terms of what's going on nationwide. And in terms of what's the scope of this though, people don't understand it. if I say, roughly in 2019, we estimate there are about 400 Big Ten basketball players. In the state of Wisconsin, we look at two-year colleges, the state schools, and the Big Ten, we look at about 700 kids play college basketball. How many high school basketball players do we have in the state that year? 24,000. There's the magnitude. We have college athletics, which is a small pinnacle, but we had a huge, huge base of athletes down below there feeding into that. So if we look at that, why do we want to do this? What's the benefits? There's so many things we talk about. Kids should play sports. What's going on? Is there really that big an impact on what they're doing? Looking at recently, they did a great study, youth risk behavior survey. Kids are most likely to have A's if they're in sports. Now, we're not saying they're causing an A, but they're saying there's huge association that grades are still highly correlated with sport participation. The kids that have the best grades in school are reporting the highest level of sport participation. Mental health. Claudia Reardon is somebody I've worked with at the state level, and now she's helped us out a lot with our COVID-19 related data. We'll bring it later. She talked about the importance of sports, and they did a great paper about what's going on and talked about the non-physical attributes, the resilience, teamwork, leadership, positive self-perception, stress management, all associated with sport participation in secondary school. This great thing. And she had a great statement. Youth sports offer the most cost-effective, widely available mechanism to improve mental health. It's widely available, it's cost-effective. It's much easier to go ahead and do that at that population level. In terms of, let's see here, quality of life, some studies, quality of life. If you look at high school athletes versus the general population at that level, or even in the school, the high school athletes are always reporting greater quality of life, higher quality of life in terms of what they're doing, mental, physical, social well-being is always better. We're seeing these consistently with these athletes. But we talk about, that's great about that level. Well, what about later on? What's going on? Do we have this translational effect for these kids as they go beyond that? There's a great recent study talked about association of team sport participation long-term outcomes. Looking at adverse reactions. If people have an adverse event in an early age, some of these can manifest themselves as mental health issues down the road, but kids in team sports have a mitigating effect. They don't seem to be having those to the greatest extent. And an adult are less likely to report depression and mental health issues if they played in sports at an adolescent. And if we talk about that's mental health, we also have physical health. We talk about, the blood cholesterol panels are better in kids that play and adults that played sports. We see this translational effect, this going forward that we see they're more physically active. When people say, how do I get my kid physically active? I'm like, you be physically active. You physically active, you're physically active, your son or daughter is more likely to be physically active too. And so this self perpetuating motion goes forward. So we like to say, if we can encompass this, real briefly, we have all these good things. Physical health, mental health is improved for the sport participants. Long-term, we see this great effect. So here's a great thing. So we know that sport participation is good. And I like to say this, and I'll bring this up again and again. Adolescent sports are not just games for kids. They're critical to improve public health. And I talked about reducing injuries. People say, and I wouldn't make friends sometimes with my athletic training colleagues that say, we need to reduce the incidence of ankle sprains, not so we keep the kid so we can shoot a free throw on Friday night at the game. We need to reduce injuries and ankle injuries so they can be active when they're 35 years old. Getting the kid back on the field, on the football field or soccer field, is not as important as are they going to be active 25 years from now to go ahead and do that. So that's what I said, bring it up again and again. My family experience, I saw this firsthand. Some of my best teachers were my kids. They were all, we really stressed the idea that they're going to be involved in multiple sports. They didn't want them specializing in anything. They had a great high school experience. They all were a varsity athlete at least once in their freshman year, and were lettered as a freshman. The school of about 800, 900 kids. They all participated on teams that never won a game. Finished last. They all were on a team at least one time that won a conference title. They all went to state as an individual athlete. They all ended up to be a captain by the time they're seniors. So you saw this great benefit. And long term, I said, I think my wife and I said, when they were all in middle school, we had 3 kids, we didn't think we're ever going to get to college. They all made it to college. My daughter's a medical lab scientist down in Tennessee. My other daughter is up in Mayo Clinic, doing some communication stuff. My son's a captain, Army captain, and I think this is not Iraq, this is in Poland. And I said, it's interesting, when we took the picture, I'm like, you're gonna go to Poland, well, thank goodness, it's not Iraq. 2 years from now, I said, where are you? He said, we're about 12 miles from Ukraine. I'm like, really? And I was like, well, that's gonna be a safer spot in Iraq, but that's another issue. Anyway, so he's in charge of a tank unit over there. So we saw this great benefit. So great, I could see this, how it really helps. But there's another issue going on here. What are injuries? This is what my wife and I dealt with through 9 years of varsity sports. Ankle sprains, stress fractures, shoulder impingement, labral tears. We had to access a lot of medical services, MD visits, ER visits, MRIs, CT scans. Okay, so now there's something else going on here. It's great to say get everybody in sports, but we've got an injury burden here that we have to be cognizant of moving forward. That I think is very important. And if we look at that, you know, what about sports injuries? How are they affecting this and what's going on? This is data from the National Electronic Injury Surveillance System, which is an approximation of what's going on, nationwide survey of what's taking place. And we query them. I had an opportunity to query them. They had a great resource in Washington, D.C. who would, I'd say, I want to know the cost of ankle sprains last year in soccer. And they would produce this data for us and say, we spent $6,000 a year last year for soccer or for an ankle sprain or something like that. We have the MD-ED visits. So these are the estimated visits for each sport. Direct costs, these are millions of dollars. That's to actually treat them in the ER, et cetera. The total costs are the total costs that we look at in terms of healthcare spending. If somebody has to take time off from work, the gas to get there, the time off from school, follow-up care, et cetera, those total costs, this is the billions of dollars that we're dealing with these sports. And again, everybody looks at, well, look at football. That's our big outlier, yeah. If we had boys and girls basketball, which has fewer participants, we have higher medical costs associated with basketball in 2016 than we did football. But it's still something to be aware of. And so it's like, well, how do we prevent this? Traditionally, you know, sports and orthopedics, sports medicine was, you know, we did lab research, we did bench research, we've done things. And I said, when I was doing this in, 25 years ago, I thought, this is great to have this data, but how does that relate to here? If we want to talk about reducing an injury here for a 230-pound linebacker, putting an appliance on them, that's great. Here's what we're, what's it going to do to a 110-pound point guard? And that data really wasn't out there. We needed to find a better way to do that. And in my studies, it said, why can't we do clinical trials? Why can't we do a drug trial essentially, or randomized interventions in the school population? Why can't we collect data out in schools? Kids aren't competing. This is not a basketball activity. This is a basketball activity. Translating here to here doesn't always work. So we need to go out and collect data, large data sets out in the field. And so what we did 25 years ago, start a research network where we would go ahead and collect data. We had athletic trainers, medical providers from around the state of Wisconsin getting large data sets. And we went ahead and did this. We started out with some trials, cohort studies to go ahead and do this. And we've done a lot of things in injury epidemiology. Who's getting hurt? Why are they getting hurt? What's going on in terms of that? We had studies in sport-related concussions, a lot of studies in sport-related concussions. Here's a rule change. For the first time where an entity made a rule change limiting tackling and hitting in practice, we're able to quantify what that did to the concussion rate in high school athletes. It's never been done before. Looking at what's going on in terms of if they have an athletic trainer, how they treat the concussions versus schools that don't have an athletic trainer. And looking at outcomes, what was going on with these kids following their injury. We did studies and injury prevention trials. For the first time ever, we looked and did this model where we could go and randomize 3,000 kids in our soccer study. Half the kids were ahead here and half the kids didn't. To go ahead and get good data instead of just having laboratory data to go ahead and do this. So we found this, and more importantly, we look at outcomes, not just return to sport, but what was going on with these kids long-term in terms of that injuries affecting them, not just today, not just this week, but moving on. So we had this, and we're going along, we're chugging along, we're thinking about all these great ideas, and bang, we have COVID-19. And so that May, 2 years ago this week, or this next couple of weeks, we're thinking, what are we going to do? How are we going to, we got to stop everything we're doing. We know health is effective in not playing sports. What's going on if we take sports away from these kids? So we had an opportunity, we got online, we worked with a great collaboration team over at the UW, including Claudia Ridden, who really brought me up to speed on some of these issues. And we designed a survey of validated measures anxiety, depression, which are used here in athletics, right? Pediatric quality of life and physical activity to go ahead and see what was going on with these kids. We started in Wisconsin. We thought we'll go through social media and get people to answer surveys, hoping to get maybe 1,000 kids. And after a couple of weeks, we had 400, 500, 600, and we had a great sample of things going in nationwide. We've heard that people are asking about it, and we talked to the National Federation of High Schools who said we would love to get that survey out. So we collected data that first year on 13,000 kids. So we had this huge data set. And it was interesting because we could look at that. We looked at, poverty level. The kids reported their zip codes. We were able to look at the poverty level for that zip code and the type of sport they were playing, individual sports, team sports. So this is what they would have played. It's March 2020. I was a football player. I'm not playing anything now. How's my mental health? How's my physical activity? What's going on? See this, we saw this phenomenon where, no kidding, the kids in the highest level of poverty, those counties were affected to the greatest extent. These scores should be up in the 85s and 90s. And they're low. How low? This is what we see with kids with chronic medical conditions and cancer. When we see those quality of life numbers on a 0 to 100 scale. That was reported then. We see that going on. And the team sport athletes were affected most. So we went ahead and did that. Now we knew we wanted to study that again the following year. In the fall of 2020 now, got an interesting situation. Wisconsin, like other states, it was a patchwork. They didn't all cancel sports like California did, to a large extent. Madison or Wisconsin left up the county or the district-wide level. So we collected data again and getting ready for a spring data collection. And we had a data set collected in the fall of 2020. Think of the Dane County kids. I might be in school, I might not be in school. I know I can't play any sports, but in Rock County, those kids played sports. Sauk County, this county I live, those kids played sports. So we looked at the data set and we showed there's huge difference, obviously. Even when we controlled for the type of school they were in, the county poverty level, the free reduced lunch at the school, that the kids that were playing sports and were physically active had better mental health, better quality of life. And Dr. Watson did a great thing. We looked at a secondary analysis of it. And when they looked at activity levels, if they weren't playing a sport, they would have maybe a high level activity level, but their mental health scores were still down. So he's saying that when we control for this, being physically active in the pandemic was helpful, but being with a sport was more helpful. The mental health issues were mitigated by the team sport participation, the fact that they were able to get out and do this. So he's talking about the mental health effects were really important here. We're not pointing a finger who played and who didn't play. I'm just saying this is what we found in Wisconsin, and we want to go ahead and duplicate that in the spring of 2021. So we went ahead and did that, but in the meantime, we're getting some pushback. There's a thing on HBO, basically in December, January 2021, how selfish kids will want to play sports. They just want to get a scholarship. Parents don't care. They're going to kill everybody in their community. They hate their grandparents. They want to play sports because they're selfish. That was the message. And I and some other people, we said, we need to push back on this a little bit and get the word out here that it's not just about kids getting a scholarship. There's other things going on here. And we got a call. Brian Gumble did not call me. A producer called me. And I was smart enough to say, you don't need to talk to me. You need to talk to Claudia Reed, who is this expert who can do this. And so she and Alex Diamond, who's on the National Federation with me, I think they filmed Claudia for 3 hours to give her a 5-minute spot. I didn't embed it, but that's a great thing if you want to go ahead and look at that. But it's like great comment. If we took the whole nation's antidepressants taken away, anti-anxiety medications taken away when we stopped the sport participation. And Alex really did, I think the risk of not playing are greater than the risk of playing. So we went ahead and the next spring, looking at data. We have data from Wisconsin kids prior to the pandemic. And so pre-COVID, we looked at activity levels on a 0 to 30 scale. This is pretty good prior to pandemic. They were here spring of 2020. 2021, it's improved. Not quite there, but it's improved. Quality of life prior to the pandemic was here, and our Wisconsin students down, rebound a little bit. Not to where we want to be, but it was better. What about depression and anxiety? Here it's interesting. The black bars are prior to COVID-19. We had a lot of kids reporting minimal or no depression, boys and girls. Very few reporting moderate to severe depression prior to the pandemic. Huge spike during the pandemic. It's down significantly in spring 2021. Now they're back playing sports. These kids are playing sports, but they're still not to where they were. There's something else going on here. And now we're asking questions. Are you concerned about COVID-19? We're looking at party level. Are they in school? Are they wearing a mask? All those type of things. We're controlling for that. We're seeing that same pattern again and again and again. But you also had a phenomenon on this. What about kids that didn't play? And our sampling in spring of 2021, school district put it out there. We said, we want to talk to your kids, even if they're, if your football season was canceled, we'd still like to have get the responses in the spring to see what they were doing, what they were thinking of. So we can look at kids that would have played a sport in 2021, how they compare to kids that did play a sport during the pandemic years. We see that same thing, same phenomenon. The kids that aren't playing a sport, even though they're in school and doing this, the dynamic is what it is. We see this huge effect in mental health. All analysis control for those factors. So we saw this moving forward. So we said, it's not just this. So here it brings up that issue of public health again. Sports aren't just about keeping kids active or whatever. There's other things going on. There's other things that are going beyond just getting on the free throw line or on the soccer field, doing that. And so maybe these next effects can be mitigated by sports. We tried to get this word out. We got 6 peer-reviewed papers. We did state reports. Interestingly, we did 17 reports for states. Every state we did a state report for in the summer of 2020 had schools allow sports that fall. And they said that we took these reports to our legislatures, our governor. I testified at the state legislature about our findings as well. And we're still getting the word out again and again that sports aren't just games. They're really, really, really important for these kids moving forward from the population health. And then most recently, I think Dr. Watson, Claudia Reardon got a nice thing. The AP News that's on the online bulletin, why sports are important during the pandemic and moving forward to help these kids. What about the challenges? What are we going to do with moving forward? If we have this issue, here's a case I like to show. I don't know if you're not used to dealing with x-rays. This is a mortise and a lateral view of an ankle. And what should be nice white, good form here, we see these little flecks of white here with osteophytes. Instead of being a nice dark area here, we have joint surfaces. It's all clouded. This is arthritic. This is a painful ankle. That's something when I see it in clinic, they're a 60-year-old, maybe construction worker, somebody that's had a lot of issues with their ankle over time. They've got all these pathologies in their ankle. It's a 29-year-old who had 2 ankle sprains in high school. How do I know? Because I saw him in high school. 2 ankle sprains. And this is what he's got to deal with. Unable to participate in sustained aerobic activities. So again, getting kids active are important, but if we're not preventing and keeping these kids healthy at that early age, we're going to have long-term effects. This person is more likely to have issues of obesity, diabetes, etc. because they're not going to be that. People say, well, just go out and swim. You can't just go out and swim in Wisconsin, right? Hey, I'm just going to go to the corner Y. There's not a Y in MCA in every corner where I go in the pool. But if I can't walk and I can't run and I can't kick a soccer ball in the backyard of my kids, that's affecting my quality of life. That's affecting my health. So I think that we looked at that. We looked at outcomes in kids, and it's interesting in our studies, 30% of young ladies that had a knee injury, there's not just ACL tears, but even anterior knee pain, were reporting disablement 12 months after an injury. 5% of their kids that had concussions in Wisconsin were still reporting symptoms. 5% is still high, but it's better than 30%. That these kids are reporting disablement following these injuries. So that's an issue of concern. What about perceptions? Here's a challenge, perceptions. They talked about parents regarding youth football and asked these parents, what do you think the rate of high school football concussions is? And 25% estimated it was over 50%. It's actually less than 5 to 6%, maybe a little higher depending on the season. 83% thought it was double. There's no way I want my kid to play a sport if I think 50% of their kids are going to have a concussion. That's media driven. That's perception. That's not reality at all. And I go back to the side. Now it's changed, but 10 years ago I got asked this question: what's the sport with the highest rate of severe catastrophic head and neck injuries? And we're like, oh, football, ice hockey, whatever. It was dance, cheer. And I said, here's perception reality. I would have parents say, I don't want my kid to play football because they're going to get a head injury, going to get a neck injury. Have you ever heard say, I don't want my daughter to be a cheerleader. I don't want my son to be holding up the cheerleader. But that's what was going on. So perception and reality are two different things that I think it's a big challenge moving forward. We have to get this out, whether it's the people say it's safe, sports can proceed during the pandemic, or what's the real risk of injury in the different sports we're playing. Go ahead and moving forward. What about lower sport participation? Anecdote, last spring, we lost a lot of kids in the area. We had fewer kids playing those alternate sports, and even like the baseball, softball teams that I was working with in the high schools, they had lower numbers last spring. And even when maybe their enrollment increased, but they had fewer kids on it. We don't know what happened. They're like, we don't know what's going on, why they're not doing it. Aspen Institute's done some national surveys. Some parents are concerned about, especially the young kids getting sick, so they don't want them to play sports. But in the community-based programs, a lot of those closed. But interestingly, nearly 30% of the parents surveyed in 21 said their kids have lost interest in sports. They don't want to play. What's going to be the long-term effect is we really don't know. What about costs? We all talked about this. Dave Bell talked about it. We talked about, kids who only 34% of the kids whose families earn $25,000 play community sports. It's double what their parents are making over $100,000. Income is a huge driving force. Remember when I talked about the low rates of ice and field hockey and high school participation, right? 2019. This was an estimated cost for a kid playing youth ice hockey or field hockey. And I told it to a hockey parent. They said, I wish it was that low. It's much higher. But conversely, the sports would have the lowest cost to get their kids involved at an early age were what? Football and track. What are the numbers there? And I'm concerned about this. Here's what I'm seeing. Are we adopting the hockey model? I say this because the sports now go to this attitude where wanting kids to play earlier and often. Hockey said, we're going to start early. You got to play early, you got to get on the ice, you got to do these things, you got to pay all this money. That's great. In the mid-70s in Wisconsin, I heard about it. Hockey's going to be the next big thing. It's going to take things over. You're going to watch. It's going to wipe everybody out. It's still one of the lowest percentage of participant sports in Wisconsin because there's a lot of cost involved. And I make the joke, kids don't ride public transportation to hockey practice, right? I want to see the car. I want to buy it. I want to go at 6 a.m. to the ice rink and see the parents' cars. I want that Lexus. I want that Tahoe. I want those type of things to go forward. Is this model going forward? I worked with the high schools. I could go to high schools years ago, 6, 7 years ago. If I was coming to girls basketball, there'd be a freshman game, maybe one JV game, maybe 2 JV games in a varsity game. Very few teams in this area, especially the urban teams, have enough kids to fill out 3 basketball teams for girls basketball. One of the schools I was working with just north, the coach had been there for 12 years. He said he had 74 girls out his first year of basketball. This last year in a school of 900 kids, he had 21 girls go out for basketball. They lost. Now his point was, yeah, but the girls that didn't come out were really not dedicated, i.e. they didn't want to play as a 5th and 6th grader, 5th and 6th grader to go ahead and get involved. I think that's great to a certain extent, but what if mom and dad can't afford for them to be able to play 5th and 6th grade? What if they don't have the $1,200 for that summer to get them involved? Kids aren't going to start playing basketball or soccer as a sophomore in high school. If anything, what we have at that 4th and 5th grade level is just going to go down. It's not going to go up. And finally, what are we publishing? We're not. Of all the data we're looking at, this is in the last several years in our sports medicine journals, only 17% of the papers are actually dealing with youth or adolescent injuries or preventions or things like that. Most of what we're publishing are adults. We're not doing a good job with that. What opportunities moving forward? This isn't a great opportunity, but we need to take advantage of this. Look at the concerns, AP, about obesity going up in kids in the last year. Diabetes is going up in kids last year. Obviously, mental health issues not just here, but around the globe. More sedentary behavior, everything we don't want, everything that is mitigated by sports is increased. So we got to go ahead and move that forward. Again, now we talked about this, mental health crisis in kids and COVID. Yeah. And somebody sent me this and said, didn't you talk about this 18 months ago? I said, yep. But it's good we're here because we got an opportunity now to say that. If somebody will say, well, how are we going to do this? People throw money at it to say, what can we do to mitigate that? Here's a solution. Remember what Dr. Reardon said. Use sports are the most widely available, cost-effective mental health intervention around. So we've got to go ahead and try to emphasize that. Can we get from here to the point where use these vehicles moving forward? Last thing, so looking ahead, key to improve, through the sports lens, we want to enhance the community and school sport opportunities, increase access to coaches. Coaches are always tough. We're like officials, we're losing them more than we're gaining them, and that's part of our own fault. It's not good enough to go ahead and say go out and play if we're not providing proper medical care. We had that athlete, like I mentioned, we had 2 ankle sprains that we didn't properly treat as an athlete. and they have problems on the road, we haven't done them a lot of favors, we gotta do that. We also have to do research on the best methods to increase participation and prevent injuries. And I'm gonna shut it off right there. Is that okay? We're all good. Like I said, every day with your grandson's a great day. It puts everything in perspective. We'll open this up for questions.
Thank you. Thank you. Well, how about who has questions?
I do. Why is there not as much research in youth and adolescent?
Money.
The age range is, I mean, like, just that pie chart really.
Yeah.
The thing that it's-
Why
not?
A lot of it's money. You know, we always talked about, I think we're talking about today, the dissertation. 10 years ago, we talked about, we get this magic unicorn to dump money and we could study these cohorts and follow these kids and do this stuff. There just is not money. Even interesting, we've been asked to apply for research funding to improve, there's the pots of money for improving the health of Wisconsin population. And we've tried this iteration here, let's get an importance of this. And, 6 years now, no. I think part of it's the funding. They're either not aware of that. For the NIH level, it's tough. The only way they're tying funding at the NIH level is if you can tie preventing an injury to increasing degenerative joint disease in adults. Anything else they're not interested in. One thing I think we do need to do a better job because of the lower level of fitness, et cetera, is the Department of Defense. They're talking about kids that are physically active to meet the minimum required. So my son can attest to this. He said, there are a lot of kids that can't pass the minimal standard to get in, and they've lowered it now. That's an issue, but funding is the key. We can do this if we can do it, if we can get the money. So if you know that person's willing to drop the check, somebody said we need to find a foundation that can go ahead and really take an interest in this and move this forward. Because there's so many things that interact with mental health, and physical activity, and obesity, and psychosocial aspects of what's going on here.
And you've done so many of those very large volume studies in high school, athletes with the ankle sprain, concussion, the balance stuff. Which one do you think was the most impactful?
From a citation standpoint, it's the balance training.
That's different, right? So great citation, and then from the
That's the one thing that they're at least like to use of. Tell the kids to do a 20-minute intervention. We can show it works, but they're not going to do it. It's hard to say. In some ways, the sports specialization stuff we look at, specialization has really driven that some of that. Where we looked at kids that highly specialized had more injuries and stuff like that. From the policymakers that seem to have, I don't know. I still, the ankle bracing one we showed, if we put ankle braces on kids, we could save X billion dollars in healthcare spending, and prevent X number of injuries. But we're still doing that. But that brings up the point. I think one of the things that did from the impact, it shows the disparity or the difference between what we're finding on the lab versus finding on the field. Part of that study, the lab research was saying these ankle braces probably aren't going to do anything. Mechanically, we have somebody, graduates who can jump off a platform that does this for the muscle reaction. So it might do that. It might affect severity, reduce severity, and you're going to increase the injuries. Okay, let's go ahead and do it. When we put it out in the kids, we found ankle injury rates reduced by 40 to 50 to 60%. Severity wasn't impacted, and there was no increase in ACL tears or knee injuries in these kids. So this idea from an impactful situation, that just showed putting all this money and time in these lab studies that don't translate to the field is a tough sell. It's maybe leading us down paths that we need to do. Eventually, we got to get the lab research is so important. We got to keep doing it. But eventually we got to get out in the field and try these things out in real life sport activities. I said, if we play basketball and every high school kid is 23 years old and a graduate student, which are most of our lab studies, right? We've got injury prevention down. But when we're dealing with 14 and 15-year-old kids, running, jumping, moving, it's hard to do.
Tim, you had the slide about the Aspen Institute's Project Play, and I'm wondering about the effectiveness or the possibilities of places of groups like that to help be champions for change.
Yeah.
In addition to like getting more money into the research, but getting the message out and having impact
Right.
at community levels.
And I think that's important. I think probably getting the message out overall. because I just assumed everybody knew this, but, you know, when we cancel sports, it's interesting, that listening to a disease person, expert that was talking about why sports are dangerous, you can't be going forward. It was clear, they were looking at through a single lens. They were looking through the broader lens, and to this person's credit, some of our coworkers reached out to this person and said, just so you're aware, here's what's going on with kids not playing, and here's the overall effects, and this person, I didn't know. They were at the mindset that jocks play football and they get all these accolades and they do this stuff, and it's the kids don't benefit from that, but without realizing the full thing, I think getting other people on board to go ahead and do this.
On a related note, I know some of their work addresses the access to sport,
Right.
less along the lines of directly attributed like mental health and that, but along lines of geography and race and socioeconomic status. I just read the story yesterday about Nike having the big contract with Kobe Bryant's kind of family foundation to increase access to sport for kids. Is there any corporate interest in expanding access and any promising buy-ins there?
We hear about that. I don't know. You know, we hear about Under Armours and Nikes and things like that doing that. I always hear that, and some we get excited, they want to partner, and those things seem to go away. So I don't know, but ostensibly, I think that the private foundation of the corporate may be an easier mechanism than to have big federal research dollars flow to this.
Mhm.
To go ahead and do that. You can cut through a lot of red tape to go ahead and do that. That'd be great if they would. You know, and I said in my unicorn studies, I said, give me a cohort of 10,000 kids in grade 3, and I'm going to follow them for the next 20 years. And we could really show all these things. Are they dropping out of sport because they're injured? Are they dropping out of sport because of lack of community access or parental support, or what else is going on, which could really drive all these things? But that magic unicorn hasn't come and dropped that money for me yet. So when then time, look at my hair, time's running out.
What's the order with the 28% on this slide, and what plays into that? Is it just the citizens' interest? Is it specialization and burnout?
We don't know. I don't know. And part of that, when you do these surveys, you always get the here's what happened, but the why is not done. That's why other qualitative people say, well, you got to come in and focus group this out. I don't know. We don't know. Maybe that's going to rebound. I saw people say that's not in my area. We haven't seen a drop off, which is good. But it's going to be important working with the National Federation of High School. What's happening to participation numbers moving forward? It's going to be really interesting to see those trends. We know, again, part of the pandemic, football was dropping a little bit. Girls basketball was dropping like a rock. Girls soccer had dropped a little bit. Softball had dropped a little bit. On the other hand, girls volleyball had increased. Girls volleyball had increased to be the most popular team sport for girls. Are those going to stay? I don't know. It'd be interesting to see.
Well, thank you so much. This is fascinating
All right.
work. We just really appreciate it. Thank you, Tim. Thank you so much. Thank you all for coming. This has been a great afternoon together. Thank you. Have a great weekend. Thank you all for joining online as well.
Mhm.